In this section, we will address some of the common myths and misconceptions about face masks and COVID-19 and how to counter them with facts and evidence. Myth 1: masks don't actually work to prevent the spread of COVID-19 and are incapable of stopping viral transmission. Fact: masks do work to reduce the risk of spreading COVID-19 by blocking the respiratory droplets that come out of your nose or mouth when you talk, sneeze, cough, laugh, sing, eat or breathe. These droplets can contain the virus that causes COVID-19 and can infect others if they inhale them or touch their eyes, nose or mouth after coming in contact with them. Masks act as a barrier that prevents these droplets from reaching other people and contaminating the air or surfaces around you. Several studies have shown that masks can significantly reduce the transmission of COVID-19 in various settings, such as households, hospitals and public transport. Myth 2: masks are only for people who are sick or have symptoms of COVID-19. Fact: masks are for everyone who wants to protect themselves and others from COVID-19. Many people who have COVID-19 do not show any symptoms or have very mild ones that they may not notice. These people are called asymptomatic or pre-symptomatic, and they can still spread the virus to others without knowing it. Wearing a mask can help prevent this from happening by containing the virus in your respiratory droplets before it reaches someone else. The Centers for Disease Control and Prevention, CDC, recommend that everyone wear a mask in indoor public spaces if they are in an area with a high number of people with COVID-19 in the hospital and new COVID-19 cases, whether or not they are vaccinated. Myth 3: masks are harmful to your health and can cause low oxygen levels, carbon dioxide poisoning or infections. Fact: masks are safe to wear and do not cause any serious health problems. Masks are made of breathable materials that allow enough air to pass through them while filtering out the respiratory droplets that may contain the virus. Masks do not affect your oxygen levels or cause carbon dioxide to build up in your blood. There is no evidence that wearing a mask can increase your risk of infections, such as bacterial pneumonia or fungal infections. However, you should always wear a clean mask and wash or replace it regularly to avoid any dirt or germs that may accumulate on it. You should also avoid touching your mask or face while wearing it and wash your hands before and after handling it. Myth 4: masks are enough to protect you from COVID-19 and you don't need to do anything else. Fact: masks are not a substitute for other preventive measures that can help you avoid getting or spreading COVID-19. Masks are only one part of a comprehensive strategy that includes physical distancing, avoiding crowds and poorly ventilated spaces, washing your hands frequently, covering your coughs and sneezes, cleaning and disinfecting frequently touched surfaces, getting vaccinated when eligible and staying home if you are sick or have been exposed to someone with COVID-19. All these actions work together to reduce your risk of infection and transmission and to protect yourself and others from this serious disease.